Hi everyone, my name's Lorna. I'm one of the Angus midwives and I care for women who are either birthing at home or birthing in the birthing unit. My video is made from home today in Costa del Montrose due to the current circumstances, and I hope everybody's keeping well. I'm also going to be looking down to refer to my notes every now and again just to make sure that I tell you what I'd like to. I'm going to talk to you today about water birth. So water birth describes labour and birth in water, but it's also a combination, it can be a combination of you labouring on land and birthing in water, or labouring in water and getting out to birth on land. It really doesn't matter. Historically, we've always used water to ease aches and pains and discomfort throughout history for all sorts of different things, and labour and birth is one of them. In my practice, water birth was not something I routinely came into contact with until I moved to Angus 8 years ago, and then it's become part of my everyday practice. Luckily now it's practice in most hospitals in most areas, and there will be a few circumstances where water birth will not be advised. However, there are pools available in all areas. So there are pools available at home. You can either hire or buy or borrow pools to have at home. You can use the pools in the birthing unit. We have a fixed pool and a blow-up pool. And there's also pools in the DMU, Dundee Midwifery Unit, and a fixed pool in Labour Suite that can be used also. For the majority of people, if you want a pool, you will get a pool. There's usually not a shortage of pools, as we do have extra pools to be inflated. My personal experience of seeing and supporting women using water is positive. I couldn't believe that just a bath of water could have such a massive difference and such a positive impact to not only women but the birthing families and partners around them. And I'd like to tell you a little bit about what that can do and what water can do for you. The information that I'm discussing today is based on research and evidence, and there have been many studies and ongoing studies to show that labour and birth in water is safe. So the different types of pools that we have. So you can have a blow-up pool. Occasionally some people choose to use big thick paddling pools for home birth. And the blow-up birth pools are usually the best choice. They are robust and they have handles to hold on to. They have a stereo liner for it also. In the hospitals, we also have fixed pools. So the benefit of them being that you can fill them up with the tap and empty them with a plug. Otherwise, we're using buckets, which is completely easily doable, and it gives people around you a job to do also, which can be quite helpful when you're labouring. We like to make sure that the water comes up enough to cover your bump so that you get the best benefit from it. So having the water all around you, touching you everywhere and over the bump is really helpful. The temperature of the pool doesn't matter until the baby's being born. So in the early stages, you can have the pool at any temperature you feel comfortable to you. We'd like to ensure that the pool is around about body temperature for when baby's being born, just to make sure that baby doesn't get too cold when baby's coming out into the world. When you get in the pool is a question we're often asked: when is the right time to get in a pool? So generally I would say whenever you feel that labour is good and regular. Although some people do tend to use it in the early stages to ease perhaps back pain and things. You do not ever have to have an examination before you get in a pool. There's so many things about what's happening that we can look at and we can discuss with you about whether we advise whether it's the right time to get in, but it's always your choice. Women tend to be pretty savvy if they get in a pool and it's too early. It sometimes can be that the labour and birth is slowed down a little bit by the relaxation effect of the pool. If that happens, and it is in the early stages, we just advise you to get out, have a little walk around, see if labour comes back. Sorry about the cat. And get back into the pool when you feel the time is right. So what does the water do? How can it help you? So it's believed that there's a combination of many aspects of being in the pool that can help your labour and birth. So it increases relaxation. It therefore decreases the amount of analgesia and stronger analgesia that you'll need. This in turn reduces the need for intervention, and by intervention I'm describing epidurals, forceps, ventouse, and it can really increase your satisfaction. Overall, women's satisfaction with their labour and birth experience using water tends to be high. You'll be glad to know that it can also reduce the length of labour. And one of the reasons that this can be the case is because it facilitates for upright labour. So you have the supportive feeling of the water, the buoyancy of the water, taking the pressure and the weight from you. This allows you to be able to mobilise and get into different positions. Your pelvis and legs are able to move and shift easily so that your baby can come down your pelvis. It also facilitates a hands-off approach. The pool is your space and it's your little protective space. It stops us as midwives fiddling and interfering. That can interrupt the flow of the birth hormones, and that can slow things down and cause problems. The water touches you everywhere. It acts as a pain relief. It's a warm, comforting cocoon that supports everything that's happening, the big soup of labour, the hormones, the mechanisms, the way that your body moves, the way that we're asking your body to move in labour, and what you're doing, and what your body and your baby's asking of your body to help allow it to be born. Taking the weight and the pressure off your body also allows for you to conserve energy, to be used when you need it most, when you're pushing out your baby. So not having to walk around, not having to hold your body up, and allowing the water to take that pressure off you can help instead. We listen to the baby as normal. As midwives, we'll use a Doppler, which is the handheld device to listen to your baby that we use at your antenatal appointments. We have waterproof versions of these where we can use that to listen to your baby under the water. We'll try not to interfere or cause you any bother by doing this, but occasionally we will ask you to move a leg if we're having trouble to listen to your baby. Partners also report high levels of satisfaction when water is used as well. Overall, water in a birthing environment is a relaxing thing to have, but also something as simple as the height of the pool allows for a partner to sit nice and close, to sit on a chair nice and close, to be able to hand you things. Perhaps you're using gas and air, perhaps you would like drinks of water over, and perhaps you would like your shoulders massaged. Your partner's in a perfect height to be able to do that, or to support you under the arms when you need it as well. You can use gas when you're in the pool. It's absolutely fine, and that's, we can pass it to you. You can pop it at the side of the pool whenever you need it also. When you're birthing your baby, baby can be birthed straight up into your arms, and we can support you around after baby's born in the pool with little intervention with it, without disturbing you too much, and you sit bond with your baby. Birthing of the placenta can be done while you're in the pool also. There's no need to get out. If everything looks completely normal, you just have your baby in your arms, having your skin to skin. Perhaps you're establishing breastfeeding, and just take your time. We'll keep you nice and warm, and be reassured that we're constantly keeping an eye on both you and your baby as this time is happening. We are always watching for blood loss and always watching for how your baby's doing, and keeping you both comfortable and cosy. So we'll maybe put a towel around baby as well, just to keep baby, a warm towel around baby, just to keep baby nice and cosy after birth. We believe that the tears are reduced as well when you birth in water. This could be because of the hands-off approach. This also could be because the water soothes your tissues, but also mostly you're listening to your body and just going with the flow, and just when your body feels the need to push, you push with it. But we don't encourage directed pushing. When you're not ready to push your baby, you'll know when your body tells you to do that. For baby, it feels like, we think it feels like a gentler kind of birth. So babies don't often scream their heads off when they come out after a water birth, although this is very common. We always watch for the colour of baby. When babies are being born underwater, this can sometimes be a concern for your partner, because the time it takes for a baby's head to come out can be a few minutes before baby's body is born and before baby breaks the surface of the water. So when baby's head is coming, it can often be that baby's head comes down your body and is sitting outside your body while the body is still inside you. It takes sometimes a little while for the shoulders to rotate, for the next contraction to come, for you to push your baby out. At that point, as the baby is half in, half out, that can be strange for a partner to think, oh my God, get this baby out quick. However, just need to remember that the placenta is still giving blood to your baby, and there's about a third of the baby's blood in the placenta at any one time. It's still circulating through there, and it will still circulate and give your baby oxygen-rich blood. The baby hasn't taken a breath yet, and the stimulus to take a breath doesn't happen until the baby breaks the surface of the water and the pressures change. So it can be a wee while as the baby's being born before baby's coming up into mum's arms, and that's absolutely fine. Babies, when they're being born like this, can sometimes look a little bit purpley and blue, and that's the case with most babies when they're being born, and it's absolutely fine. Babies are slow to pink up, but are usually pink and often crying within the first few minutes. But sometimes they just come out, sit in your arms and just blink up at you and look at you after they've been born. There may be times that we ask you to come out the pool, and this could be if perhaps at any stage we think there's a delay with labour, there's a concern regarding birth, we aren't sure if you've peed, so there could be a time where we ask you to get out. The thought of getting out when you're in labour, especially if you've laboured before, might seem like an impossible task, but for most women it is completely achievable. In the blow-up pools, it's just a case of getting you just quickly over the side, and we also have beds that can come to the side of the pool in the birth unit and things like that to help you crawl up and onto them if that is necessary. However, that is often not a problem at all. If we feel the pool is too cold, we will try and heat it up as quickly as possible, but there are occasions where we can't get it warm enough, quick enough, and we may ask you to leave the pool, just because if the baby's born into particularly cold water, it can kill the baby too quickly. We'll always keep an eye on your bleeding, and if at any point we're feeling it's getting difficult to tell how much bleeding you're having, then we would ask if it's okay if you don't mind coming out the pool, so we can get a wee bit of a more accurate look at what's the blood loss that's coming from you. At any point, if you feel faint, we would get you out the pool quite quickly, just in case you do faint in the water. It's quite unlikely that would happen, but it's a good idea. If you're starting to feel a wee bit rubbish, we'll get you out. Also, if, for example, you were in the water and we felt the placenta wasn't coming away, we would ask if you could come out. Just sometimes gravity is all it needs to help that come out. The cons with the pool, it's not advisable for you to have diamorphine when you're in the pool. Diamorphine is the injection, the painkilling injection that you may choose to have throughout your labour. Having this can depress your respiratory system, so it can slow your breathing a little bit and make you feel quite sleepy. So for that reason, we ask if you come out the pool and stay out the pool for about 4 hours after having it. Cons, and I'm trying to think of times when women have said they wish they'd never been in the pool, and I can't think of that ever having happened. Women who have birthed before, who birth very, very quickly, have sometimes said that they just didn't make it in time. They would have chosen it had they had the choice to, but they just haven't made it in time. But the majority of people who choose to birth in water or to use water as part of their labour and birth care, in my experience, have enjoyed it. So I hope this wee bit of information has been helpful to you. I've probably missed out something along the way. I'm sure something very important, I'm sure. But if there's anything at all that you would like to ask about labour and birth and water, please don't hesitate to ask your midwife when you see them. And as part of your birth plan, we'll always discuss with you whether water is something that you would like to choose. Okay, hope that's been helpful. Thanks, bye.